So why don't we go ahead and get started? Happy Friday. I hope everyone is having a great week, and I hope your allergies are not flared from this dust storm, because mine sure are. So if I sound nasally, that is why. So I wanted to do this webinar on fall immune support because cold and flu season is officially here. It's back. It's coming with a vengeance. A lot of our patients are getting those pesky little colds and flus and sinus infections. And, you know, with kids being back in school and all of us traveling again, it's expected that we're going to have these colds come up. Our immune systems are locked and loaded and, you know, trying to go, but have been a little dormant over the last few years. So I wanted to touch on the basics, touch on, you know, some different ways that you can support your immune system going into the holidays, and really work on encouraging that immune function versus suppressing any symptoms that may arise. So the agenda for today, we're going to overview the immune system. If you have seen a webinar of mine before, you know I like to talk about the science a little bit at the beginning. I promise I'll keep it short, but I know a lot of you are interested in that. And so I wanted to touch on, you know, what is the immune system? What is it made of? And then we'll talk a little bit on acute versus chronic infections, talk about how prevention really is key. And then we'll go over some immune supportive herbs and different supplements. We'll talk about nutritional IVs that we offer here at Living Wellness, vitamin injections, and then the Anthosh immune shot, which a lot of people don't know that we offer. And so I wanted to talk about that. So here's the overview of the immune system. It is made up of the innate immune system, which is the immune system that we have from birth. So that's our immune system. Those cells are ready to fight infections right when they're exposed. And so that consists of most of the white blood cells. So the neutrophils, the eosinophils, the basophils, those are part of that innate immunity or non-specific immunity. And it's considered non-specific because it is not directed at specific viruses or bacteria. It's just used to fight an infection. It gets the alarm that there's something invading that's not self, that's other, and it goes to attack and it goes to defend. And then we have our acquired immunity, or that's considered our specific immunity. So those consist of mostly T cells and B cells that have memory. And so once your body is exposed to a virus, typically we will have antibodies that form. Most of those antibodies will stay around. Some, you know, they don't stay around forever. They may stay around for a few years, for 10 years, and then you kind of lose that immunity over time. But for some people, they have those immune cells around. So if the body is exposed to that specific virus or bacteria again, then it can take some of the acquired immunity that has developed and use it to attack. One note is that viruses, there's different strains. As I'm sure all of you are aware, with everything in the news, there's different strains of viruses. And so just because your body made that acquired immunity to a specific virus, if that strain has been altered, then it doesn't have the same level of immunity. It still may have some, but it's not as specific. And so when we go over a CBC, or a complete blood count, there's the white blood cells that are listed at the top, and then we have all the breakdown of the immune cells down at the bottom. And so if you're a patient of ours, you know that we like to go through those, talk about what those mean. But here's a nice picture on the left that talks a little bit more about what those cells do. So neutrophils engulf and destroy, so do monocytes, and some of these engulf the bacteria or virus. Some of them more so send out little attack signals. And so neutrophils engulf and destroy, and so do those monocytes. Neutrophils we typically see elevated with bacterial infections, whereas monocytes and lymphocytes may be a little more viral. Eosinophils and basophils are important for both parasites and allergies, and so that's when those can be elevated. And I like the picture on the left because it talks about the different organs as well that are involved in the immune system. So we have our tonsils, our lymph nodes, the thymus gland, our spleen, which is where a lot of white blood cells live and are produced. And then we have our lymph vessels that go all around our body to exchange some of these cells and some of the messengers. And the bone marrow, which is where the white blood cells are produced. And I think that's all I wanted to say on this. There is the little information on barriers, which is so important as well, if you see number 1 there. And so these are barriers that help defend our body from any of the microorganisms. So we have our skin, our mucous membranes, in our nasal passageways, in our throat. We have our stomach acid. So again, we may have talked to some of you, our patients, about the importance of stomach acid and not necessarily suppressing it when we don't need to suppress it, because that stomach acid allows us to kill specific bacteria and virus that it may come in contact with. And then we also have the gut microbiome. We'll talk a little bit more about that later, but it's so, so important in the immune system. So many of our immune cells live in the gut, and so it's very crucial that we have the beneficial bacteria there, that it's in a nice balance, that we don't have a lot of gut dysbiosis going on, or we can see some of these more chronic infections when that's occurring. So that's it for the science. The rest of this will be a little bit more directed at what can you do. And so I just wanted to make a little point here about acute infections versus chronic infections. For this talk, we're going to really be talking about acute infections. And so that's the typical cold, the virus that you may get. Chronic infections is a whole different animal, and that's more so the chronic Epstein-Barr virus, the chronic Lyme, and we do treat that as well. But for this talk, it's really geared toward those acute infections. Prevention. So truly prevention is key. And then the foundations of our health are key to make sure our body is able to adequately fight these infections and, defend against what we may be exposed to. It's impossible to limit our exposure, especially, just going out in the world. There's toxins, there's bacteria, there's viruses, and that's part of, being alive and living. We do have more sources of exposures in enclosed places. And so that's something that, during the holiday season, we're traveling, we're spending time indoors with a lot of our family, depending on where you live. A lot of times that's, more in close quarters indoors because it's colder outside. For us here in Phoenix, we don't have that problem as much. We can now, thankfully, start doing some more things outside. And so a little less, prevalent there with us being cooped up inside, but maybe more so in the summer months. And that's why I feel like here, these colds and flus started happening a little bit sooner than expected. And maybe that's because we've all been inside. And then the foundations that I wanted to touch on, of course, is nutrition. You could take any supplement in the world, but if nutrition is lacking, then it may not work as effectively as we would like it to. And so really trying to prioritize antioxidant-rich berries and fruits, and limiting alcohol consumption, limiting processed sugars and processed foods in general. For many people, dairy can also be inflammatory. And so in general, what I like to recommend is, stick to that healthy diet that, is that foundation. But at the first sign of illness, really try to cut back on some more of those things. And so not necessarily avoiding dairy forever or avoiding alcohol forever. Moderation really is key. But if you are feeling sick, try to stay away from those inflammatory foods and inflammatory beverages. And then stress is another big foundation. I like to talk with all my patients about stress management. We could all use a little more self-care. And so stress can actually suppress the immune system. In acute stress, that revs up our immune system. But in chronic stress, our body is in this state of just being that wired and tired and kind of like on the go and running around. And in those moments, you're not going to be able to rest and to really have those cells respond and fight the infections like we would like it to. So stress management is definitely key. Sleep is so important. Sleep is where our cells get to restore and where they get to replenish. And so if we're not getting adequate sleep, that's definitely something that can contribute to an infection lasting longer than it should, or just getting sick in the first place. And so really aiming to make sure you're getting the hours that your body needs with sleep is key. Movement is also important. Movement before illness, and then when you're ill, really try to listen to your body. So if you're feeling run down, maybe doing a HIIT workout that day is not necessarily the best idea. still, you know, get up and walk around and maybe go for a walk outside, but also try to listen into that intuition of what your body is telling you, because when we're sick and we really try to push it, sometimes that's also going to further suppress the immune system, just like chronic stress would. And then also getting some time in sunshine. We like that. Vitamin D. I'll talk about vitamin D when we talk about supplements, but if you can get good absorption from being outside, like that is amazing. And so especially now, you know, we can spend more time outdoors, really in the early morning hours. We don't still want to be, you know, outside and getting sunburned. We want to avoid that. So I think that's all I wanted to touch on there. Some general tips. I think most of you all know this, you know, washing your hands, not touching doorknobs and putting them in your mouth, you know, kind of the basics. So I won't go further into that. Everyone knows these. Here's the fun part. So immune supportive herbs and supplements. So again, like I said, foundation is key, but when we're sick, we can bring in some of these amazing nutrients that we know and that have been shown to help fight infections and support the body. And Biotic Extra is one of our go-tos here. If you have called in with an acute illness, you've probably been talked to about Biotic Extra. So this is a very nice combination of different vitamins, minerals, and herbs that are designed to promote good health by supporting the immune system. And they actually also have some antimicrobial properties to them that they can help when fighting infections. And so the dose is very different when you're trying to support the immune system just day by day, and when you are acutely sick and needing to take something in the moment. So typically, you know, when you're sick, you're going to have to be doing things pretty frequently, like every 2 hours. And so that's something to keep in mind, that, you know, what it says on the bottle might not be what we recommend when you are sick. And so that's why it's good to talk to your doctor about this and even make an immune support protocol preemptively. And so if you don't have an appointment, you know, for a few months, or it's going to be hard to get an appointment if you're traveling, ask your doctor to say, hey, you know, if I get like a simple cold, what are some things that I can do? What are the doses of them? Because then it's nice to have that on hand. And Biotic Extra specifically contains vitamin A, it has B6, magnesium, zinc, some bioflavonoids, some ginger and garlic, and grapefruit seed extract, and then a nice blend of different mushrooms. And so that is like a good place to start by itself. Another one that we commonly recommend when people are acutely sick is cytozyme thigh. So this is actually organ thymus gland extract. And so our thymus gland is where our T cells mature. That's a part of our acquired immunity that we spoke about earlier. And so this is actually providing that gland itself, which is then going to further support fighting those infections. And so that's one thing, again, where the dosing when you're sick and the dosing when you're trying to prevent illness is very different. Next are different mushroom extracts. So some of the most supportive mushrooms for illness and immune support, you know, preventatively, are cordyceps, shiitake, maitake, and reishi. And other than the mushrooms, one of the big hitters is vitamin C. So this is an amazing antioxidant. It's so immune supportive. It's also really supportive for allergies. The one caveat here is that in high doses, it can definitely contribute to some loose stools. And so that is one thing too that your doctor will definitely talk about. Like if you're going up above 5,000 milligrams, then it might cause some loose stools. When you're acutely sick, maybe not. But if you're trying to do it as a preventative, then we typically recommend a lower dose. Vitamin D, I don't think I need to go too deeply into vitamin D. I think everyone knows how important it is for immune support. The dose, again, depends on what your levels are without supplementation. And so that's why it's really important to have labs assessing where you are. I've only had a handful of patients where their levels are in the range that I want them to be in without supplementing. And so that is one to consider, especially, you know, for us, it's a little bit the reverse. When we're in the summer, we may be a little more deficient than when other places around the world are in their winter time. And that's because we're just indoors and we're not getting the vitamin D. And then zinc. Zinc is so important for healthy immunity. It decreases oxidative stress, supports the function of the white blood cells, specifically those macrophages that go and engulf the pathogens. And so the dose on this one is different if you're trying to prevent versus if you're trying to treat. And so most multivitamins have a little bit of zinc in them, and that's typically good with prevention. But treatment, you're going to be doing a higher dose, and you want to do it with food because zinc on an empty stomach can definitely cause some nausea. Probiotics, so this one is huge considering the gut and the microbiome of the gut and how tied that is with immune function. So we want to make sure we have good beneficial bacteria in our gut. We can get some of these by eating more fermented foods, eating sauerkraut, and then also rotating through probiotics. So one thing that I personally like to do is only have someone on the same probiotic for 3 to 6 months before rotating, because I don't want to just keep giving the same beneficial strain. I like to get some other strains in there. And so that's something too to consider. If you've been on the same one for a few years, maybe it's time to switch it up. And then vitamin A is very, very antiviral. We love to incorporate this into our plan as well. The main thing here is that in high doses, it can definitely be very toxic to a fetus. And so if someone is trying to get pregnant or is pregnant, then we definitely do not give them high doses of vitamin A. Some herbs, so elderberry, echinacea, berberine, and then even just, some of the things around our houses. So garlic, onion, ginger, all of these have very different immunomodulating effects, antiviral effects, antibacterial effects. So one thing that I have some of my patients do, which they may, not prefer that I recommend this, is add some raw onion to a tea. And so seeping your tea with, a throat coat tea or a nice soothing tea, and then adding some raw garlic to that or raw onion to the bottom can help. Same with ginger. Ginger's a little bit less strong in that sense, but really focusing on getting some of those in. And so what's so nice about herbal medicine is we have so many of these things in our kitchen already. And so we have them and we just have to know to use them when we need to. Next are some at-home therapies. And so these are different things. A lot of them are targeting the same theory or same philosophy, if you would say. So the saltwater gargles, that's going to help just clear anything. You want to make sure that's more on the warm side. It's going to be more protective to the mucosa. Neti pot sinus rinses, that's going to actually help clear the sinuses and help thin the mucosa, or not thin the mucosa, thin the fluid that is there and get it out. And so that's a nice one, especially with times like these dust storms or times when we are maybe exposed to more pollutants or even in the environment, not necessarily illness, but even allergens. We want to really make sure that we have a good nasal irrigation system going. Steam inhalation is nice because it's going to provide some hydration to the mucosa. The mucosa is more effective to fight infections when it is moist versus when it is dry. And so especially here with the dryness, we want to make sure that we have some of that moisture coming in because we're not getting it in the environment. So that's where a humidifier can be nice. Main thing about humidifier to note is that you want to make sure you either clean it regularly or check it regularly and don't let water sit, because we do not want mold to grow in the humidifier. That's doing the opposite of what we want. And so adding a humidifier, especially to the bedroom at night, so you don't wake up with that dry nose, kind of dry throat situation. Hydrotherapy is great. Just ending your shower on cold is a really easy way to add in some hydrotherapy. That's going to help increase circulation, increase lymph movement. And then similarly, magic socks is a form of hydrotherapy where you put cold socks on your feet and then you cover those up with dry wool socks. Go to bed. Your body is going to heat up the socks. It's going to have its attention and really help increase circulation and kind of do the pulling effect of helping bring down that mucus, bring down some of that congestion. And so those are some really easy at-home therapies to do, to just have in your back pocket when you may feel something coming on, or to do them more as a daily prevention. The magic socks, you don't need to do as a daily prevention, but the steam inhalation or the neti pot, those are some easy things that you can do. Next, one of our favorite things to offer are nutritional and therapeutic IVs. What's so great about IVs is that you're bypassing the gut. And so a lot of people have gut malabsorption issues. They have irritated lining in the gut, and so they may not be absorbing the nutrients that they are taking orally. So when that is the case, we do like to really recommend some of these nutritional IVs. We have our basic Myers that has all the B vitamins, vitamin C, calcium, magnesium, zinc, and selenium. And that's a nice starting place, either before traveling, after traveling, the first sign of an infection. Those are really nice places to start. Then we have the Mega Myers. That's everything I just listed, plus glutathione. And so glutathione is a major antioxidant in the body. And so that one's nice. It gives you a little added, oomph. And so those are two of the most commonly recommended ones. And then we also have vitamin C IVs. And so vitamin C in lower doses is more of an antioxidant. In higher doses, it can be actually pro-oxidant. And so that one, your provider would have to recommend which one. For all of these, your provider will have to, give you a recommendation and give you a prescription for them. They're not drop-in IVs. Glutathione, alpha lipoic acid, and NAD, again, really, really good antioxidants for the body. These are also some that we use more in the chronic infections that I spoke about earlier. And so these are just standalone, glutathione, alpha lipoic acid, and NAD. So those are also some that we are offering now. And then we're also starting to offer ozone therapy. So we have a webinar coming up in December on ozone. So keep your schedules open, or it's going to be hard to keep them open in December. But keep it on your mind that in December there will be a webinar. And so ozone therapy is amazing because it helps our body produce its own antioxidants, and it really helps with increasing the oxygenation of the body itself. And so it's more of a push to get your body to produce more instead of necessarily just giving the antioxidants. And so that's something that I really love about ozone therapy. Next, we have vitamin injections. And so typically we do either B vitamins or vitamin D injections. And so that depends again on what's recommended case by case. The B vitamins are really going to help enhance energy, metabolism, and immunity, and then also can help increase focus, especially if you're deficient in them. So these you will typically notice that same day or the next day. It's going into the muscle, and so it's not going directly into the vein like an IV does, but it goes into the muscle, which then is going to bypass the liver metabolism, and then it's absorbed more readily and more quickly. And then we also do vitamin D. Those are also going into the muscle, and those will depend too on, some people come in monthly just as a preventative, or they prefer to just do a monthly vitamin D so they don't have to worry about taking it orally. And again, as we spoke about earlier, can't say enough about vitamin D. It's so, so important for immune health. And then next is Anthosh Shot. So this one is a homeopathic immune supportive remedy. It's very antiviral. It helps to relieve cold and flu symptoms like runny nose and sore throat, some muscle aches, more of a mild fever. It helps reduce the duration of viral infections. And there's not many interactions or side effects that we have seen. And so it can help just really be a nice immune bump. And so some people, again, do these more immune supportive, where they like to do them to help prevent getting sicknesses. And then other people, at the sign of infection, they will do them. And so you can do either. I would, again, ask your provider. If you are really healthy, you may not need to be doing as many of these preventative things. Of course, it's important to, and you need to have those foundations met. But some people, if they're getting frequent illnesses, then we really want to, bring in that daily support and do something a little bit stronger. And so next, I think I've really labored that one away, that remember the foundations. It's so important to have your nutrition in a really good spot. It's so important to have your sleep and stress well managed, and having, community too. And so don't be afraid, going into the holidays. That's the last thing that I want to promote here. I want everyone to be with their loved ones and, be able to spend time together. But just remember, there's so many things that you can do. If you get sick, give us a call and we can make a protocol specifically for you. We can go through what things you have in your house, so you don't have to necessarily come and get new supplements. We can see, okay, do you have vitamin C? let's increase that. And this is the dose that I want you to do. And so just remember that we are here. And I should have told you all at the beginning, but this is a time for questions. So I know we do have some questions in the chat. So let me look at those. Okay. Should I do an IV before traveling? So I would say it depends. I think that it's a good idea to do one before traveling as a little boost of your immune system beforehand. And so then you are better ready to, fight any infections. Your nutrients are there, you're hydrated, all of that is in a good place before you're traveling. You could also do it when you get back from traveling, or again, like if you're feeling a little bit off, or if you had an illness and it's been a few weeks and you're wondering, why isn't this gone? Then that's also a good time to do it. How long do IVs take to work? So again, it depends on the person. A lot of people notice that night or the next day, they will feel a difference. And so they'll either feel really sleepy that night and sleep well because they're given all these nutrients that their body may have been lacking. And so they sleep really well to better process everything that just happened. And then the next day, they feel more energy. They feel a little bit more clear-headed. And so it also depends on which IV you're doing. Each of them have a little bit different things that they're targeting. And so if we're targeting nutritional status because there's a gut issue versus if we're targeting just doing one of those antioxidants. And so some of them take a few times to work. You may not notice a difference after one. That shouldn't get you discouraged. You may just need a few more. How long do I need to be on an immune support protocol if I am sick? So we typically recommend either 5 days or until you start feeling better. And so if that is longer than the 5 days, that's okay. We will write specific instructions on, take this high dose of vitamin A or vitamin D for 5 days only, and then go back down to your maintenance dose, because we don't want you staying on a high dose for too long because it's not necessary. And then that's when it could potentially be harmful if you're staying on a really, really high dose for a month at a time. Okay, we have a few more. What dose of zinc is recommended? So typically for daily support, preventatively, I like people to be getting around 15 to 30 milligrams. And then if they are sick, I bump that up to about 50 milligrams a day. And like I was saying earlier, with food is the key, because if you take 50 milligrams on an empty stomach and you don't get nauseous, let me know, because you are rare. It's definitely one of those nauseating ones. And I don't know exactly why that is, but it's super common. Okay, what are your thoughts on emergency? So emergency, I'm not the hugest fan of because there's a lot of added sugar in it, which I feel is unnecessary. You can get most of those same ingredients from a multivitamin or from a specific supplement that doesn't have any added sugar. But if you're in a pinch and you're traveling and you don't have things with you, then it does actually give you a decent amount of the vitamin C, but it does have some additives that I'm not a huge fan of. And then how often do I come in for a vitamin D injection? So that depends on your baseline levels. Some people, it's every 2 weeks. Some people, it's every month. It depends on the baseline, and then it depends on how much you're getting at that time and how quickly you absorb it. And so we'll touch base, or you'll touch base with your doctor about, oh, I felt a benefit for 2 weeks and then it kind of subsided. And then we know, okay, maybe we need to increase the frequency to every 2 weeks. But it's always important to test and to make sure that your levels are in a nice range, they're in the optimal range, they're not too low, and then also not too high. So let me see if there are any more. Let me just refresh this real fast. No, I think we're all set. So thank you all so much for being here and for listening. I appreciate it and all of your support. And I will see you all around the office. If you need anything, don't hesitate to reach out. And I am here, and we are here to support you during this holiday season. So have a great weekend, and I will talk to you all next time.